Hello, ladies and gentlemen. My name is Gary Baumgarten, but I expect you already know that. And I welcome you to this discussion on Facebook Live, paltalk.com, and on YouTube. Well, are your teeth starting to feel dirty? Do you need to get them cleaned by the hygienist? Do you have a toothache? Have you lost a filling, a crown? Do you have an abscessed tooth? Do you want to get that pain taken care of? Do you want to go to the dentist's office and get it resolved right now? Because believe me, we all agree when it comes to dental pain, it's always an emergency to the patient, always an emergency. But now with the COVID, can you do it? Well, here in the United States, some dental practices have started to reopen, but now throwing cold water onto all of that are new recommendations from the World Health Organization, which are not exactly the same recommendations as we get from the CDC, which say, you probably don't want to go to the dentist, at least not yet. So what's the real answer? Well, we decided to go right to the source, to the main man, to Dr. Chad Gehani. He is an NYU professor and he's president of the American Dental Association. Dr. Gehani, welcome to this discussion on Facebook Live, paltalk.com, and on YouTube.
Thank you, Gary, and thank you for giving me this opportunity. Currently, 99% of the dental practices in the United States are open for routine dental care. We were never closed. In the month of March, end of February, beginning of March, when COVID started hitting us hard, at that time, we decided that it will be in the best interest of the public that we as dentists take a social responsibility on ourselves. So from the social responsibility point of view, we did not want too many patients to crowd in the dental office. We wanted to save the PPE for more of a serious nature, such as in the hospital situations. So many of us even donated our PPE to the hospitals. And we decided that if we keep our practices open to emergency dental care, the patients will have a place to go for an emergency toothache kind of situation. And we on our own decided that we will postpone routine dental care. So the dental offices were never recommended to be closed, but they were recommended to take care of the emergency dental situations like that. 2 days ago, when WHO, World Health Organization, came out with the report, which is rather an old report, but their announcement just came recently, that has caused some confusion amongst the public. We at the American Dental Association respectfully, yet very strongly disagree with World Health Organization's of recommendation to delay the routine dental care. Now, we would have agreed with them in the month of March, because at that time, the situation was different. At the present time, I think that's our stand, that we oppose and disagree with their statement.
So Dr. Chad Gehani, you make a very important point, and that is that even before this pandemic, unlike other places where they've had to learn how to use PPEs, like where I get my hair cut, for example, they never wore that there before. In dental offices, this has been in place for years.
In the dental offices, we have the PPE in place. Now we are much more strict about the usage of like N95 mask. At one time, we used the mask in certain surgical conditions, but in many of the routine care, we perhaps did not pay attention to the use of the N95 mask. We did not routinely use the face shields as we do it now. And the gloves, we have always used the gloves. The dentist, by training, from the very first year as a dental student, when we entered the dental school where I teach dentistry, we teach our future dentists special training, and they are very well trained about controlling the infection because we are dealing with mouth all the time. The dental offices have always been very safe to visit, and now we are taking extra precautions to make sure that the dental offices are the safest place for a patient and feel comfortable to visit a dentist.
So obviously we are told, and I think this is accurate. I know there's a lot of arguments going on, a lot of them politically motivated about what the COVID really is and what it really does. And I know it changes almost on a daily basis as the scientists in the medical community learn more and more, but it's the droplets, the respiratory droplets is how it's transmitted. And obviously, if a dentist or a dental hygienist or a dental technician is rooting around in my mouth and they're spraying water and all that and telling me to spit, my droplets are going all over the place. So I think I would be more concerned about me infecting my dentist and his or her staff than my dentist and staff infecting me.
And that's why CDC, as well as the American Dental Association, CDC stands for Center for Disease Control, and the American Dental Association both have the recommendations that whenever possible, use a dental dam. A dental dam is a small piece of rubber that goes on your teeth and exposes 1, 2, 3, or 5 teeth, however number of teeth, a limited amount of teeth that you wish to work on. It only exposes those teeth. And then we are using the high speed vacuum like suction. And we are also using the saliva ejector. So the production of the aerosol is minimal. Is there aerosol anywhere in the atmosphere? As I'm speaking to you, depending upon how loudly I'm speaking to you, if I speak very much in my lips, I'm still producing aerosols, but they are very less amount. If I'm yelling at you, I'm producing more aerosols from my mouth. And if I'm laughing at you, I'm still producing aerosol. So many times my dentists, my patients have come to me and they have said to me, Dr. Gehani, you used to talk a lot and socialize, and you used to laugh with me, crack jokes. What's wrong with you? Nowadays, you're very quiet. Now the dentist in the dental office now is very quiet and only talks what he has to talk, is because they are even trying to control the production of aerosols overall. Is there any way we can stop aerosols in the whole atmosphere? As long as there are living human beings, we will be producing some aerosols somewhere. From the dentist point of view, when we do the cleaning, at one time we used to use routinely Cavitron. Now you will see dentists doing many times a hand cleaning. So if you see your dentist doing hand cleaning, please don't pay attention to it. That is to minimize the aerosols. If you go to the dentist office and you see no magazines, there's a reason, because there are no magazines or toys in the dentist waiting room. Or if you go to the dentist waiting room and see very few chairs or only 2 chairs, I'll use my office as an example. My office waiting room used to have about 14 waiting room chairs. Now I have only 4. And there's a reason for that. We are minimizing the traffic. We are minimizing the number of people staying in the dental office.
So instead of queuing up in the office, I queue up outside and there are lines on the sidewalk, I bet, in front of
Um,
many
we,
offices.
yeah, we will not make the line outside of our office, but what we do is we pre-screen the patient, like either me or my office manager will call the patient a day earlier. We will ask their medical history, recent medical history, recent travel history, and we'll instruct them that please wear a face mask when you come to our office, which is quite understood by the patient. And then we tell them, as you near our office, please call us on your cell phone and we will make sure that there's no one in the waiting room. If is a person or persons in the waiting room, we try to tell the patients to wait till we clear up people from my office. So we have minimal amount of patients in the waiting room. I prefer to pretty much take the patient in the office, in my treatment room, as soon as they arrive, after taking their temperature, every patient and accompanying person. And by the way, we advocate no more than one or two persons, maybe one with the patient to come with them. At one time, we didn't care. Everybody's temperature is again taken at the door. We again go through the medical history and we make sure that we minimize uh, uh, people in the office and we follow all the social distancing. I have not seen a dental office making a line outside of their dental office yet, but there may be cases like that.
Well, good thing that the dental offices aren't run by the Department of Motor Vehicle because people are still in line now who got in line at 4 o'clock this morning. I guarantee you that it's in some states, including here in New Jersey, because I just went through that, believe it or not, today. But I know, Dr. Gehani, that the decisions that people make on whether to go in for routine dental care are individual decisions. And I'm sure you can appreciate that despite all the assurances that you are giving, that some folks are reticent to go in for the routine preventative maintenance that we should be doing on our teeth, including tooth cleaning, which a lot of people overlook and is so very important. But in the case of these emergencies that we opened up our discussion, I can't stress to people how important it is for them to go see the dentist. Now, I have a friend. No, I did not punch her in the face. I swear I didn't, but she probably has, I'm not a dentist, obviously, but she probably has some kind of an abscess tooth and her cheek by her jawline is sticking out about a quarter of an inch. It's pretty pronounced. And I keep telling her, go to the dentist. You need to get this taken care of. You're in excruciating pain. Don't live with the pain. She's popping antibiotics. It seems to be helping. But maybe this would be a good time for the man in charge, the president of the ADA, to reiterate, underscore what I have just said.
Well, let me first address your friend's concern first, and then I'll make a general statement. Tell your friend, please go to the dentist. She can call me, I can refer her to a dentist where she lives. By just taking the antibiotics and postponing her dental treatment, she is not doing her body any favor. She's actually harming her body by taking the antibiotic that she may or may not need. Keeping the abscess in the mouth for a longer period of time can cause more destruction, more damage, and maybe more expensive work to be done sometime in your future. So if your friend is listening to me, please tell her, call me. I'll advise her where to go, but please do not neglect. Coming back to your comments in general, I want all of us to understand that good general health begins from good oral health. Oral health is very important and vital part of overall health. So when we are talking about routine dental care, it's not an optional thing. I am diabetic. I do have some gum condition, and I'm speaking for myself. If I go to the dentist and get my gums taken care of in a regular way, I am saving about $127 for the insurance company's bills on the medical side. And I'm also saving a lot of grief to my body by stabilizing my gum condition. So, especially the gums, the periodontist, the periodontal treatment, which we can call it gum treatment, is essential, and it is absolutely linked scientifically to the diabetic condition and certain heart ailments. So it is not an option to go to the dentist. It is something that we should be regularly doing it in order to prevent other systemic disease. Dental disease are usually preventable when they are found in an earlier stage. They are a lot cheaper and much more effective to take care of them when prevention is done in the oral cavity in the mouth rather than waiting till an emergency.
I know exactly what you're talking about. I've had periodontal work. My dentist, who's a terrific dentist, by the way, he has me coming in twice a year for the cleaning. And it's a deep cleaning because he doesn't want me to have to get my gums cut again. And believe me, neither do I. I thought this was going to be my last question, but you spurred a final question. And that is, maybe you could expand a little bit about why or how good dental health or the lack of good dental health can affect your medical condition as well.
Absolutely. As I explained to you, using my own example, uh, um, many of the heart conditions and the diabetics are definitely interconnected with the gums, the bleeding gums, the infection from gums. I will also give you another example. Not too long ago, a patient came to my office demanding. She went to the dentist and she thought she needed a root canal on her lower left first premolar tooth. This patient demanded that she needs the root canal now because she was having excruciating pain on the lower left premolar tooth. As a dentist, my job is to not just start the root canal, but do my routine dental examination of that particular tooth. And I decided in my professional judgment that her dental ache, the pain from the tooth, was not of dental origin. It was of some other medical origin, nothing to do with dentistry. So I politely asked that patient to go see her physician. She was quite upset at me for charging her for the consultation, spending 45 minutes in my dental chair, not doing anything to her, just talking to her, and then at the end of the day telling her that you don't need a root canal, but you need to go see your physician. Guess what? 2 months later on, she calls me with huge apology. And later on, she actually paid visit to me with bouquet of flowers. It was not the toothache that brought her to the dentist office, although the patient thought it was a toothache. It was actually the heart condition. She was having cardiac pain, which in medical terminology, we call it referred pain. So many a times the cardiac pain is very much referred to the lower jaw, and in extreme or some cases, even in the upper jaw. So dentists are very essential part of treating a lot of medical conditions. And the time is limited, but I can tell you stories after stories after practicing in New York City for about 40 years now. Going to the dentist is very important. In short, I can tell you.
Well, I'm hoping that this, as we all are, this coronavirus disappears. But the reality is we have to adjust to the situation. And it seems to be here for a while. I'm not, again, a medical person or a scientist, but I think we're stuck with it for a while. It didn't disappear seasonally like people had hoped in the beginning. And we can't avoid taking care of the essentials, even if we are locked up in our houses because we consider ourselves high risk. We have to take care of the essentials. And I'm glad we did this interview because as a result of it, you've motivated me because I haven't seen my good friend, Dr. Friedman, in a long time, my dentist. And now you got me a little bit worried, to be honest with you. So I'm going to give him a call tomorrow morning and set up an appointment. Thanks for taking the time.
And I know Dr. Friedman well. Please communicate, convey my best regards to Dr. Friedman. Again, dentistry is an important and vital part of overall health. 99% of dental offices are now open for routine dental care. 70% of the public who have been surveyed are very comfortable in visiting their dentist. You might see some changes in your dentist office, but those changes in your dentist office are made for your safety, the safety of the public, and of course, the safety of the staff of the dentist and the dentist families themselves. So please do visit your dentist.
Very informative interview. You were a delight to meet. Love to see you in real life sometime. Maybe that'll happen since we're both in New York. Dr. Chad Gehani, who is an NYU professor and president of the American Dental Association, thanks for joining us today. And as I like to say at the end of all of our discussions, everybody be safe and peace out.
Stay safe, and thank you for the interview.